Welcome to our October speaker series. It's a hot topic and
Number
a hot
two.
topic.
Oh,
It's
did you plan that, Sue?
my joke now. I just created that right there on the spot, Erin.
I love it. I love it. But
Ah,
this
so
is, I think
fun.
this is going to be a very hot topic. So I know I've told you many times, I'm really looking forward to this discussion and learning, and I think it'll be a really great event.
Yeah, for sure.
All right, wonderful. So if you want to, of course, as we usually say in our speaker series, please feel free to use the chat to share with us where you're tuning in from. I know we will have members from probably East Coast to West Coast. I'm in Philadelphia. Go Phillies for those that might be in
Hmm.
Arizona. But yeah, so we'd love to hear where you're coming from. Oh, Dr. Singh, you're in Arizona.
I'm not
Yeah,
actually. I'm
she
not. I'm
is.
I'm in
No?
Norfolk,
Okay.
Virginia now, but
Okay.
Oh, okay.
Okay.
I do have a little bitty warm spot for the Diamondbacks, close to my Cubs spot. But
Mm, yeah.
Yeah,
Yeah. I know
wonderful.
we were debating if we were going to wear our Phillies red today on the speaker series or not. We decided to, let's just be humble. Let's be
I
humble.
know, I know. But we have some great locations. So Minnesota, Montana, wonderful.
Yeah. Love it.
Lancaster, yeah.
Awesome. Love seeing all
Kalispell,
that
one of
in
the
the
most
chat.
beautiful cities in our country.
Mm,
Mm, yeah.
love that. All right.
Yeah, we
Excellent.
got
So we'll,
24 on already. It's great.
I
Yeah, very
know.
vibrant topic for sure. Tonight, as everybody knows, we are talking about treated related menopause. So tonight we're going to be discussing these treatment related symptoms and side effects. And Dr. Singh will focus on explaining what's happening during that time and why the symptoms occur. And plus, she's going to provide tips for symptom management, including hot flashes, night sweats, body aches, disturbances in sleep and mood, sleep dysfunction, and vaginal dryness. So, all areas that we know are definitely interrupting our daily living and how we can manage those. So, we're really excited about this, Dr. Singh.
Absolutely. And of course, we want to give a big thanks to our sponsors. I'll share my screen because, as always, we have such wonderful support behind us to continue to allow us to bring these really important, thoughtful, engaging topics like this evening with really incredible partners and experts in the field like Dr. Singh this evening. So, of course, I want to give a big thanks to our presenting sponsor, West Pharmaceutical, for being our, greatest education cheerleader, but we also have additional support of which we are so grateful to Daiichi Sankyo, Merck, Lilly, and GSK. They keep us moving forward, so we are so thankful for them. And I
We
will
are.
give a little housekeeping as well. So I foresee a lot of questions and engagements. Of course, we want it all. Feel free to add your questions to the chat as Dr. Singh is moving through her presentation, which we will have available in our library for you tomorrow. So there'll be a lot of information shared, but you're always welcome to go back and re-review along with the video. Sue and I will be monitoring the chat for questions. And we'll be sure to pass them along, but we'll also have time at the end for a lot of good discussion.
Yep.
Perfect.
Yeah.
Wonderful. I was just reading Tiffany in the chat there. I didn't know you could do that, Tiffany. I'm looking at that you can actually do AI to give notes and follow along. So she actually enabled AI to take the notes for tonight so that she wouldn't miss anything.
Oh my
Wow.
Something new for me. I'm looking at that. I'm like,
Me
oh, Erin,
too.
yeah, I'm like, did we click a button or something for Sue? Do we
Yeah,
have a,
I feel like I haven't been
oh,
brave enough about that, but Tiffany, maybe so
she
that
doesn't
didn't
even
really
know.
happen.
No,
You're
she
not really
doesn't
doing
know
that.
what.
Oh,
Okay.
I do see the
Ah,
AI companion at the bottom. I guess that's what that is. That's
yeah,
really
I guess
interesting.
that's what that is. Yeah, we
Mhm.
keep learning, Erin. I'll tell you, it started with a ring light in 2020. It all
And
started with us all
look
getting
at
our
where
ring
it
lights.
left us.
Look at us now. Look at us now. So good.
Hey ladies, so are
Wonderful.
you
Well,
good with me sharing my screen now?
yeah, Yeah. I think, Erin, do you want to talk about the SE experts first? Let's get that,
Yep. I'll give
just a
one
couple
quick
announcements,
reminder.
Dr. Singh. Yep.
And then we'll do a quick introduction. So wrapping up October, we've had a lot of great digital events this month. So we are rounding out our education events next Thursday afternoon, October 26th, 1 p.m. Eastern time. It is our Ask the Experts, which we stream live on the Unite for Her Facebook page. We are bringing back our partner Triage Cancer. So Joanna Morales, who is a cancer rights attorney and CEO of the organization, she'll be answering all your questions about navigating healthcare and insurance, finances and employment, cancer-related legal issues, and more. I believe it's the time of year for Medicare to get reissued. So she'll be covering that as well. So she truly is an incredible expert in this legal field, and we're so grateful for them. So come prepared. I will put the link in the chat because you're welcome to submit your questions ahead of time for our Ask the Experts. So, and then as always, just like tonight's event, if you're not able to join us next Thursday, I will be recorded and it'll be in our Her library. So if you can't make it, send us your questions. We'll get them answered during the time and then check back later.
Perfect.
Wonderful.
All right, Erin, I'm going to let you rest your voice a little bit. I'll do the opening for you.
Thank you. I know, I'm not sure what happens.
She's been cheering. That's what's what happened. All right. So tonight, let's welcome Dr. Singh. She is a women's health advocate and an integrative gynecologic oncologist. Dr. Singh received her medical degree from Northwestern University and master's degree from the Harvard School of Public Health. She completed an obstetrics and gynecological residency at the Johns Hopkins Hospital and a gynecologic oncology fellowship at the MD Anderson Cancer Center. She completed her doctoral degree in public health on cost analysis at the University of Texas School of Public Health and associate fellowship in integrative medicine at the School of University of Arizona. She is a long-term member of the advisory board for FORCE, Facing Hereditary Cancers Empowered, one of our partners as well, and the board of directors of Physicians for a National Health Program. So please join me in welcoming our guest, Dr. Singh.
So happy to be with you guys. I really enjoyed last October talking to your group, and I'm glad we could do it again. I'm gonna share my screen, and I'm gonna jump right in from that perspective of I'm gonna make your guys' time worthwhile. So it's weird to start with abbreviations even before my title, but I'm putting them in there for two reasons. One, to remind me. So I think one of the hardest things about dealing with healthcare is that we have our own language over here, and a lot of times it's so mixed up. And so I'm going to do my best to translate, but not ignore kind of the medical words that you all might find yourselves using when you talk to people. And then, like Sue and Erin mentioned, you guys will have copies of these, and well, let's just move on. So I'm going to, let's see why this won't let me forward.
I did love these abbreviations, by the way, Dr. Singh. I appreciated them. So thank you.
Yeah, well, usually I make it my second slide, but I was like, you know what? We'll just put them out there. People will kind of get a sense. And again, it'll repeat in the slides, and I'm happy to do it. But again, it's like learning the language, learning the acronyms. You guys are doing it anyway. So just a tiny little bit more about me. I finished my cancer training in '99, so I've been a practicing GYN oncologist for almost 25 years, and I finished my integrative medicine training in 2010, 11. And it's really interesting and kind of nice when you've been doing both things for a long time. I feel like they kind of naturally get married. So I'm going to do more of an integrative oncology approach tonight, just because I think the traditional medical approach to things you all are already seeing with your providers. I will cover those things as well, but hopefully you'll get a taste of kind of a different way of looking at things. So we're going to talk about how cancer treatment leads to premature menopause, And then how menopause interacts with our stress nervous system and our stress response. And then talk briefly, because there's so many symptoms, but kind of what are the health impacts of early menopause? What are the range of symptoms and how those symptoms can like really overlap with cancer symptoms and cancer treatment side effects. And sometimes it's why some symptoms don't get paid attention to because the cancers become the focus. So what does it mean, integrative oncology? I mean, what I'll say is I think our worlds are getting married, and the longer I've been doing this, the more I feel like even within Western medicine, we're starting to be more holistic. But traditionally, we kind of like treat a symptom. You have a hot flash, you have nausea, you have constipation, we treat those things, or you have breast cancer, that's what we treat. And integrative oncology sort of has always taken a whole person approach. And I think it's especially important with cancer treatment related premature menopause because your treatment team is focused on that cancer cure. And sometimes, the person and quality of life get lost in that. And so integrative oncology is going to be centering how we live, food, activity, sleep, social support. And one of the things that I found that wasn't part of how I originally talked about integrative oncology is that integrative oncology comes from traditional herbalism, thinking about traditional Chinese medicine, Ayurveda, homeopathy, naturopathy, like wherever we can get tools to help people, we take them. And one of the things that's a part of all these traditional medicine tools is an understanding of our stress nervous system and its response. And if we think about, say, Ayurveda, where like these drugs or herbs, adaptogens and nervines, and yoga have always been a part of it, and massage, or traditional Chinese medicine where Tai Chi and breath work are kind of built into that medical system. That's something Western medicine lost along the way. But they're really important tools for dealing with this impact of chronic stress and life transitions. Menopause is one of those, right? So I'm going to real brief talk about our nervous system. So the autonomic nervous system, that's the nervous system that does stuff when we don't have to think about it, right? When our heart rate goes up or our blood pressure goes up, and it's in response to things that we don't make it do it. And it's a balance between our fight or flight nervous system, the sympathetic nervous system, and rest and digest, or the parasympathetic half of that system. And when I say balance, I don't mean balance like this. Ideally, parasympathetic system would be dominant most of the time. That's when our body is building tissues, repairing tissues, when cells are growing and dividing, and when like those cancer preventive genetic repair mechanisms are the most active. Unfortunately, the way we live, there's data that shows we have our sympathetic nervous system and adrenaline and cortisol levels up for some people 60 to 70% of our waking hours. And we think the reason is that like there's a whole range of like physiologic and psychological stressors that turn it on. And sometimes it's life-threatening, right? I'm in an accident, I'm bleeding, my heart rate goes up, my blood pressure goes up, it keeps blood going to my brain and my heart, and that saves my life potentially, right? But then there's times when we're multitasking, when we're driving, where, yep, maybe we do need quick response, and maybe we do need some adrenaline to be able to let us respond to things when we're driving. But by the time we stop, we don't need it anymore. And we don't need to run fast. And we don't need the inflammatory kind of hormonal biochemical cascade that comes from stress hormones, adrenaline, cortisol, white blood cells, prostaglandins, all those things that our body thinks it needs when it's, being chased by a saber-toothed tiger. Well, we don't really need those when we're multitasking. Grief, loss, worry, all those things turn on that sympathetic nervous system. And what we know is that this chronically activated state is probably what contributes to inflammation. When we talk about inflammation contributing to disease, we think about cancer, we think about cardiac disease, we think about obesity, we think about diabetes, we think about a lot of neurologic and rheumatologic diseases. And in Western medicine, unfortunately, we've gotten focused like on the diseases that come at the end, not like, can we do something about this chronic stress and activation that leads to these diseases? And again, like I said, these traditional medical systems have thought about this and incorporated those tools for a long time. So how does cancer treatment lead to premature menopause? Sometimes it's not on purpose. It's the way that chemotherapy damages ovaries, either directly or by hurting the blood supply to the ovaries. Sometimes it's very deliberate, right? We're removing the ovaries. You know, sometimes when I talk, I use the term castration, and some people find like castration, but that is what it is, right? And just in terms of learning about like how globally impactful that is. On the other hand, sometimes it's life-saving because getting rid of estrogen is the thing that controls the cancer or cures the cancer. Sometimes we're deliberately suppressing hormones as a part of treatment. And then I know, you know, our group is people mostly with breast and ovarian cancers, but certainly things like radiation therapy to the pelvis, there's other things that can impact the ovaries as well. And one of the things, you know, that we're only recently starting to understand is like, what are the nerve connections of the connections between the stress nervous system and menopause? So when our ovaries stop working, the hormone that our brain used to make that stimulated the ovary to do its cycling thing starts increasing because the brain is like, well, the estrogen's not there, so I need to get that ovary working. Now that FSH, that hormone, is similar to adrenal-cortical stress hormone, thyroid stimulating hormone, and all of the mood-related neurotransmitters, like think about serotonin, which is kind of one of the biggest neurotransmitter. That's the one that when we use things like Prozac or paroxetine or for depression, those are the neurotransmitters that are being impacted, right? SSRI, that's what describes that Prozac class, serotonin reuptake inhibitors. So making that neurotransmitter hang around longer. Serotonin is inherently and closely related to melatonin structurally, and melatonin, another thing that goes down over age and is substantially decreased after menopause. We've got estrogen receptors everywhere, right? Not just heart, bone, but also brain, but also nerve tissue, gut tissue. And understanding like these relationships between the hormones and menopause and the stress nervous system, it helps us understand why there's so many symptoms when we talk about the symptoms of menopause, right? So anxiety, depression, that mood lability where you're just every little thing triggers you. Those are neurotransmitter related. People describe palpitations, sleep disruption, right? Palpitations, think about the adrenaline. Sleep disruption, think about your melatonin being off. Fatigue, think about all of these things we're talking about. The low sex drive, desire aspect of it. And then those cognitive symptoms that for some people are their main symptom, right? That they just can't remember things, that they, you know, they're standing in the middle of a talk and they forget their next word. Again, it makes sense when there's these intimate relationships between our ovaries and our hormones and our brain function. Over time, people get vaginal dryness, and we'll spend some time talking about that. But think about that list of side effects and think about cancer and cancer treatment side effects, right? Think about chemo and body aches. Think about like, you know, cognitive symptoms, chemo brain, like the overlap is dramatic. And again, I think it's why sometimes symptoms don't get addressed the way they should because we're not realizing what they're connected to. So this is not easy, but in a way, like thinking about the global health impacts of early menopause is kind of a checkbox we could take care of. What we know, the research tells us when you go through menopause before the age of 45, you have higher risks of bone loss, osteoporosis, hip fracture, cardiac disease, high blood pressure, weight gain, diabetes, cognitive disorders, and dementia. And all of these might be aggravated by treatments if you're on tamoxifen or those aromatase inhibitors like letrozole, exemestane. And so how do we prevent those things from happening? kind of one, letting your primary care provider know you went through menopause early. And so some screening and health maintenance that they wouldn't have done until 50 or 55, they need to start earlier. Things like checking your cholesterols, checking your vitamin D, your B, your iron, your magnesium, your blood sugar. Bone density studies might be appropriate depending on your other risk factors. And other ways, right, for prevention, lifestyle approaches. Weight-bearing exercise, like clearly, even in people who've got some bone loss, osteopenia, weight-bearing exercise is better treatment than most prescription medications. We know 30 to 60 minutes of physical activity daily decrease the risk of cancer recurrence for breast cancer, endometrial cancer, prelim data for ovarian cancer, but decrease the risk of stroke, diabetes, heart attack without any, it doesn't have to be about losing weight. Just that activity has those protective benefits. I'd also encourage you guys all, and in my end of slide, I have some nice references for good sources for the anti-inflammatory and Mediterranean diets. They are the best cancer prevention and cancer recurrence prevention diets out there, but they're also the best general health, cardiac, and brain health diets. Basically, having a plant-based diet, 5 to 7 servings of vegetables, fruits, more veggies than fruits. For women, especially including those cruciferous vegetables, broccoli, Brussels sprouts, arugula, getting enough protein, getting enough of those protective omega-3 fats that are part of the anti-inflammatory mediators that we need, getting enough sleep, managing stress, social support. Sometimes supplements and herbs come into that, things like calcium, vitamin D, magnesium. Those class of herbs that I mentioned, the adaptogens and the nervines, this is where in a lot of those traditional medicine things, we use those drugs or those supplements and herbs, and I'll talk a little bit about them. So just quick definitions, right? Perimenopause, the time before menopause, when hormone levels are coming down and ovaries are ovulating less often. Menopause is defined as 12 months and no periods. But, when you go through treatment-related menopause, that process may be instant, as in your ovaries were removed and you woke up from surgery in menopause, or in a matter of weeks with a couple cycles of chemo or anti-hormone therapy. And then post-menopause, of course, the time after. Now, VMS, vasomotor symptoms, kind of the medical word for hot flashes, night sweats, temperature sort of instability, feeling hot when it's cold. It's interesting to say like 50 to 85% of women experience them, right? And honestly, when I was a resident, right, in the 90s, I was told they weren't real. And you'll see as we go through the research, like obviously we know they're real. But now we're starting to understand what are the pathways that lead to them. For most people who have hot flashes and aren't on a treatment that aggravates hot flashes or that causes hot flashes, most of the time they'll go away sort of in a range of 4 to 6 years. About a quarter of people will have them after 5 years of a natural menopause, but 10% will have them 10 to 20 years later. One of the things that I find really interesting when we look at the studies of like what works for vasomotor symptoms or hot flashes is that there's a high placebo response rate. And early on, that was one of the like stupid, annoying reasons people were like, well, they're not real then. Well, no, placebo means I think I'm taking something to help me with this. And just that act of caring for ourselves is something that we know turns off our cortisol, turns off our sympathetic nervous system, and turns on that parasympathetic nervous system. So this placebo response rate actually just suggests what now we know. Our autonomic nervous system is in that process. And then kind of how we studied it, how we measure hot flashes, like a lot of the studies are flawed. In your chat, and you guys will have a link to the North American Menopause Society document that came out in 2023. And they do a really good job of sort of like in a very traditional way, looking at all the tools out there. I think it's a great reference, and it's a great reference for the language. So I try to give them credit. Like that's where I write this from NAM's business, just so you know where I'm getting it. I don't agree with everything they say, but I think they're a good reference. So I'm not going to spend a ton of time talking about hormones, simply because I think a lot of people on the call are not eligible for hormone therapies, having hormone responsive cancers. And so we'll talk about the standard approaches. There's this newer technology called a stellate ganglion block that makes sense for people who have pretty severe symptoms. Again, it's a procedure that involves potential risks, and it really hasn't been taken up well. And we'll talk about the integrative approaches. So as I mentioned when I started, right, when we talk about integrative approach, sorry about that. When we talk about integrative approaches, we talk about whole people. So now as I'm getting into these slides where I'm talking about just a symptom, it's hard to take that info and apply it to yourself, right? Because maybe you're having hot flashes, but also fatigue, or also anxiety, or also sleep disruption. Maybe you are allowed to do some things or aren't to do other. Maybe you already have certain side effects, and so I'm talking, in a non-integrative approach, but I think it's meaningful to at least look at the data and help give you guys the tools to start thinking about. So this is straight out of that NAMS handout that you guys all will have. What are the prescription medications that we use? This is the one that I really like the best of them, laxofene, Effexor. I've had the most success with it, where about 30% of people's hot flashes get dramatically better, 30% of people's get a little bit better, 40% of people don't get a ton of benefit. There are side effects to all of these medications. And again, interesting, right? All these other medications, the paroxetine, these are those Prozac family drugs, the SSRIs. So it makes total sense, right? Why, like, it's the neurotransmitters that are being affected and why these medications might be benefit. There's a sleep medication. I'm not that, excited about it. It seems to decrease nighttime, but not daytime hot flashes. And there's a drug that in the NAMS thing, the reason I left it in like this is it says it has not been approved. It has gotten FDA approval. And so I'll talk about it. Sorry, it's flipping through slides because it's one, but I actually didn't want to spend a ton of time on this slide, except you have the references and the referrals to be able to talk with your practitioners. This is the new drug, Veozah, and it's really exciting, right? Like I mentioned, when I was a resident, people literally said hot flashes are in women's minds. And now we're starting to understand, no, there's real things, and we've figured out, like, what are some of the receptors in our brain that are regulate body temperature, that are impacted by lack of estrogen, and coming up with medications that address that. One of the reasons I got into these gory details here is just to point out, so one dose of Veozah decreased hot flashes, moderate to severe, from about 12 a day to about 6 a day at week 4 and about 4 a day at week 12. In the placebo group, 12 a day to about 8 a day at week 4 and 7 a day at week 12. And I just get into those things because ultimately, when it comes to thinking about taking a pill, a medication every single day, a relatively newer medication that might impact, we don't know all the other kind of things that receptor does. It's just something worth thinking about. I use a lot of medications for a lot of things. I do surgery, I give chemo. I 100% believe in their potentials to cure and to improve quality of life. But I just think it's important to see. And of course, they're not going away completely. So we still have work to do. Lots of data around mind-body approaches, clinical hypnosis, cognitive behavioral therapy, guided imagery, mindfulness, breathing techniques, physical activity, all some consistently showing benefits, some small studies showing benefits. Again, it all makes sense. Understanding, like, how much of the symptoms are related to our nervous system and how it affects our whole body. Remembering, I keep pointing at the brain, but our nervous system is throughout our body, with the bigger percentage of our nervous system actually based in our gut.
Dr. Singh, we did have one question that came through quickly. Does that drug bring up blood pressure like other antidepressants?
So all of the antidepressants do not bring up blood pressure. They do it in different ways. And that one, as I know of, I actually haven't used it. But its biggest side effect that people worried the most about was how it impacted the liver, not blood pressure. So I don't think it does. And it works in a completely different pathway. So I don't suspect that it will. I'm not doing so great on time. I was hoping to do a breathing exercise with you all. So you know what? We're going to do the breathing exercise. We're not going to do it 4 times. We're just going to do it once. All right. So the breathing exercise is my favorite 4-7-8 breath. Comes from Ayurveda. You put that tip of your tongue against the ridge of your teeth. When you breathe in, you're going to breathe in through your nose. When you breathe out, you're going to almost make a whooshy noise, pursing your lips. All right. So we're going to empty our lungs. We're going to close our mouths and inhale through our nose. 2, 3, 4. Hold that breath for a count of 7, 2, 3, 4, 5, 6, 7. Breathe out, making that whoosh noise, kind of emptying your lungs, squeezing in that stomach. Count of 7, 8. We're going to do one more. Breathe in, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Out, 2, 3, 4, 5, 6, 7, 8. I'm not even doing the breathing and I feel calmer. Moving along in our talk, not wanted to give you guys as much info as I can in the time we have together. Acupuncture, tons of great data, especially for someone going through chemo, having nausea, having body aches, having the mood stuff, having sleep disruption. There's so many things that acupuncture can help with. And really the challenge tends to be cost, access, needing those frequent visits, but good data, especially when you're on something that might be aggravating the hot flashes by prolonging the anti-estrogen effect, things like those aromatase inhibitors and tamoxifen. Before I talk about herbs, I'm just going to talk real quickly about safety. And in the United States, quality of herbs is not well governed, and there have been contamination. And so you have to work with good companies, reliable companies. I'll give you guys, some references for those, and ideally work with trained people who can help you with those. Herbs are physiologically active. That's why they work so well, but obviously they can have other side effects, right? There's herbs that can have potential for bleeding, for having a sedative effect that can impact anesthesia. Just like medications interact with each other because they change how our liver breaks down medication, herbs do the same thing. St. John's wort, really similar to Prozac and that class of drugs. And so just like that class of drugs increases the breakdown of some drugs, making them less effective, St. John's wort does it too. Echinacea, licorice, decreasing the breakdown of some drugs, so increasing the circulating activity, meaning sometimes making medications have more side effects. These are some sources. Consumer Lab, I think it's like $20 a year you can join. They do a great job of reviewing, like, what are the supplements out there? What's the research? What are the brands? And they actually look at, like, in this jar of something that's supposed to be, black cohosh, how much black cohosh is in it? Did it come from the right part of the plant? And they do cost comparisons. And so they're a great company. Sloan Kettering's website on integrative medicine has an herb database. And then there's another website, Cancer Choices, great source for information. All right. So traditionally, herbs were not used to treat single symptoms, but to treat constellation of symptoms like menopause, like life transition, like stress. And herbs, of course, have many parts, different than pharmaceuticals, where we try to find one active part of a drug and see how it works. Now, the truth is most drugs don't just have one active part, right? Taxol impacts cell division, impacts apoptosis, impacts angiogenesis. Even those drugs that we consider more narrow have these multi-activities, but it's why they have side effects, right? So think about chamomile, which soothes the GI tract, the gastrointestinal tract, can be calming, especially for kids, mild anti-anxiety, topical and internal anti-inflammatory. And a lot of these herbs we're going to talk about fall into this category of adaptogens, which are medications that were thought to help support the stress nervous system, increase the availability of cortisol and neurotransmitters when we need them, and help sort of decrease when we don't. Nervines, mostly thought of in the other old-fashioned term was tonics, things that can kind of soothe or relax. Again, like in Western medicine, we have much more like on-off ways of thinking about things, right? As opposed to supporting things. And then herbs obviously can be taken as food, which is the traditional use of them in cooking and as teas or as supplements. And it's when you're thinking about taking it as a supplement that I think you gotta connect with your pharmacist, have somebody who understands herbs and their side effects, so they can think about the other medications you're on and make good global recommendations for you. So here, like doing exactly what I said we shouldn't do in herbal or integrative medicine of thinking about a single symptom by itself, you're going to see overlap in these, right? Anxiety and insomnia, like melatonin, 5-HTP, valerian, lemon balm, chamomile, drugs that, nausea, immune support, astragalus also is a nice adaptogen and support. So a lot of these have multiple use. And then I deliberately chose the pictures here, which are companies that I think are reliable for these specific things. Most of our safety data comes from Europe. As I mentioned, that's where their FDAs do look at these drugs. And then the how effective are they, again, varies by the supplement. I know one of the places we are the worst is the fatigue, brain fog of both menopause and chemo brain. And some of the things that have been effective for menopause kind of fall into this category. These adaptogens, ashwagandha, ginseng, rhodiola, holy basil, shatavari, really interesting one for menopause especially. And then like an area that's an even newer area of research, medicinal mushrooms, things like cordyceps and reishi, lion's mane, a really interesting mushroom for cognitive support that's now being studied in traumatic brain injury and showing some really nice results. And again, some good companies and good sources. Herbs for menopausal symptoms, and we'll get into a little more detail. But again, valerian, St. John's wort, black cohosh, looking at the plants, just remembering where they came from. So flaxseed is a really interesting one to me. Again, you guys are going to have all these gory details in your slides. I want to leave some time for questions. But again, like a healthy addition to a diet and known reduction of decrease in intensity and number of hot flashes. People worry about phytoestrogens, right? We'll talk about soy also. But what we're learning over time is that most of these phytoestrogens are safe and potentially even beneficial, right? Flax itself has been shown to improve the activity of tamoxifen, decrease tumor growth in tumor models. And we'll talk about the same with soy, right? Where we have meta-analyses that showed benefits of soy. A lot of inconsistency in the studies. And over time, what we figured out is that there are actually some people who aren't able to break soy down into the most effective compounds. Only about a quarter of women in the US can break soy down into this S-equol, which is thought to be the most active component, and maybe why we didn't see the effectiveness for hot flashes and the anti-cancer benefits that are seen in some countries where 50 to 70% of women make this S-equol. Overall, if you go to Europe, if you go to North America, if you go to the American Institute of Cancer Research, in general, people think that soy foods are safe, and even the soy isoflavones. Large studies that showing that women with estrogen receptor positive breast cancers who are on tamoxifen had better cancer outcomes, better quality of life, better responses to tamoxifen with 3 or more whole food servings per day. Again, those studies that showed the most benefits came from countries where 50 to 70% of women broke down soy in a way that they got to this effective component. So that effective component is now being derived from a patented fermentation process. And again, really interesting, marked decreases, 30% better than placebo in specifically hot flashes, but also some of the myalgias and achiness that comes. What's interesting, most of the data says it's safe in terms of breast and endometrium. NAMS did not agree with this. And what I'd say is, this is relatively new that it's come to our market. It'd be one of the things that I would sit and talk with someone about, and kind of think about where you are in your cancer journey, and how important are anti-estrogens, and are you on one? I wouldn't take this without consulting somebody who individually knows what's happening with you.
Dr. Singh, we did have a quick question that I thought was good to bring up, if I may. Oncology dietitians and oncologists highly advise against taking any supplements or even vitamins, as they're not regulated, and the high doses can even have an adverse effect. Are the supplements introduced here okay to take?
So, yes and no, right? Some of these that are coming in this food source of a tea, likely really safe. You want to put sage on your chicken. You want to use it in a tisane that you made on your own. Absolutely. But that blanket, like, just don't take anything. I don't think that's the right answer. I think that comes from people who aren't understanding. And that's where there's some value to getting an integrative dietitian or an integrative oncologist or a naturopath who understands these things, or a pharmacist involved in your care. Honestly, back in the day, when I went and got my integrative training, I thought what I would find out is that, like, none of these things work. And what I found was that, no, actually lots of things work. It's just a whole part of medicine that most doctors, pharmacists, and nutritionists aren't trained in. So are these all blanket safe for everybody's on this call? I don't know. I don't know enough about y'all. And so I would never say go out and buy a jar of Equal. And that's why I spent that time kind of making that point. You need to talk to your individual providers. On the other hand, using these in food amounts in general, really safe. Using them as supplements. That's why I said that specific thing, that you get your care providers and find someone who understands it to help you make those decisions. Right? So on this slide, I have a tea, extremely safe, a supplement, one you'd need to talk to someone about. So as we talk about herbs for menopause, black cohosh, kind of a really interesting one. Traditionally, it was not used for hot flashes, but was used, and where I found the most benefit is for more of the mood aspects. And this black cohosh plus from Metagenics that has this motherwort and lemon balm in it, I found it so helpful for people who have palpitations, combined with some hot flashes not being the biggest part, but where the mood parts of what they were going through with menopause were the biggest things that affected them. Again, I haven't had a lot of success, and the red clover studies are mixed, but using it as a tea, extremely safe. Other potential health benefits from that. Valerian definitely interacts through our serotonin nerve transmitter system, showing some benefits. So again, if you're going to take that on, I'd want you to talk to your pharmacist and your physician about it. Kava, another really interesting one. Again, really safe for anyone to try and experiment with in the teas. If you're going to get it as a supplement, I'd recommend you're going to get higher doses out of that, and you're going to want to be talking with a provider about what you're on and how it could interact. St. John's wort is extremely closely related to Prozac itself, right? It is very similar structurally to it. And there's a lot of theories that that's kind of where it evolved from. And so again, it's going to have interactions with meds. On the other hand, lots of historical and research showing benefit for some sexual well-being, as well as other symptoms. And again, more widely used in Europe than they are here. we are running late. And so I'm going to kind of introduce you guys to these slides so you have them. And again, talk about decreased libido as an individual thing. Again, understanding it's complicated. It can be related to all kinds of other things that aren't about hormones, that are about going through cancer treatment and having changes in our body, about being on medications that can decrease libido, like that Prozac family. And again, there are hormones that we use that we might not use in some substances. Great supplements and herbs out there that, again, have a long history of being used both for female and male sexual dysfunction. Prescription medications out there worth talking to your provider about. One, getting off prescription medicines possibly that are causing them. Wellbutrin, a really interesting one that I found to have some real benefits for increased sexual pleasure, arousal, and orgasm. There are women who don't have increase in libido related to Viagra, but do have better arousal and orgasm. And that makes sense because Viagra works by bringing more blood supply to the clitoris and the vulvar area. I am not a big fan of the two next prescription drugs. Aditi has a lot of side effects, only approved in premenopausal women, lots of side effects with alcohol. And it's something you take daily. And I haven't had good benefit with it. Vyleesi is an injectable used just before sex. Again, only approved in premenopausal women. Lots and lots of side effects. I have had a couple patients have benefits, but ultimately kind of not stay on them because of the significant side effects they had related to them. But I do think there's hope that we continue to research. My favorite supplement for decreased libido is maca, which has a long history of being used, showing no impact on any hormonal functions, but seeming to impact sexual dysfunction, and being kind of available in almost food sources where you put the powder in a shake. And a lot of athletes use it because that's the other place we see some benefit in fatigue and muscle repair afterwards. Korean red ginseng is something a lot of herbalists use for sexual function. It may have more benefits for men than women. And because, like in traditional Chinese medicine, it's kind of a heating herb, I tend to use it less, but there is some research out there supporting it specifically for symptoms. And again, something that has no estrogen impacts. Another ginseng study. Ginkgo, another interesting one. Kind of mixed studies out there, but something that has not a lot of side effects with other medications and potential for benefit, as well as some cognitive benefits. I'm not, again, going to spend a ton of time talking about vaginal dryness, except for kind of introducing you to some products I love. Seeing your gynecologist, getting an exam, making sure you don't have like a yeast infection or a bacterial vaginosis. That's more common with the pH changes that happen in the vagina, both with chemotherapy that kills off the normal flora and with menopause and thinning of those tissues. This Femdophilus is the probiotic I've found the most useful. And you can actually put the capsules in the vagina and get local benefit without necessarily having to take it orally. Thinking about the osmolality and the pH of the things you use both as vaginal moisturizers and lubricants. This is an area, again, just like with those teas and with the supplements when you're using them as food, where you could experiment a little bit. You know, thinking about lubricants, this company, Good Clean Love and Yes OB, both are pH balanced, organic, and appropriate osmolality, so they're not irritating. I usually tell people to avoid the things that smell and have flavors. And then, you know, these oil-based ones, I don't generally recommend as a moisturizer, but for people who need just something a little thicker, a little more emollient, it may be worthwhile. using as a lubricant with sexual activity. And again, Yes has a really nice oil-based one. And organic coconut oil is something a lot of my patients have found a great success with. Thinking about using a vaginal moisturizer like on a regular basis, 2 or 3 times weekly or even daily if you're having symptoms. Again, this combination of Good Clean Love's feminine wash that has some aloe vera in it and their vaginal moisturizing gel, I've had a lot of good luck with. You may be, even with an estrogen responsive cancer, eligible for some of the vaginal estrogens that are low dose and time release. And so they're worth discussing with your gynecologist. This osmorphine, I've included it. There's mixed data about whether it's in the tamoxifen family. And so there are some estrogen receptors it turns on. So it isn't approved, but I put it on there because people ask me about it. Vaginal DHEA, which does not cause an increase in circulating estrogen levels, I've had a lot of good luck with. It's also a prescription. And so something worth talking to about if your main problem or symptom is about the dryness in the vagina. People will go so far as to be having multiple bladder infections related to the thinning of those tissues. And so I've seen some really good responses to this. And again, I just mentioned like vibrators and dilators and thinking about how improving blood supply to the area can help, both with decreased libido and with pain during intercourse. I promised that I would give you guys these sources. So Finding an Integrative Oncologist, the Arizona alumni website has some good information on general lifestyle approaches. Anti-Cancer Living comes out of MD Anderson's Integrative Oncology Group. I mentioned the Consumer Labs and the Sloan Kettering website for herb info and the cancer choices. SallyFoley.com, she's an awesome nurse from University of Michigan who talks about vaginal dryness, especially for people who have dryness related to pelvic radiation. Some people with ovarian cancer might have had, and then some other sites. And these are some good sources for organic teas and herbs. Mountain Rose Herbs is a really nice way to get things like turmeric root, astragalus root you can use in cooking. And then the Good Clean Love. None of these guys pay me anything. And I actually do contribute to some of them financially to support their philanthropic activities. So I'm going to leave you guys with the anti-inflammatory triangle and give ourselves 7 minutes for questions. I'm going to stop my sharing. Actually, I'm going to just bring your guys' pictures up and leave the sharing so I can see you guys. Erin, Sue, are there questions in our chat that you think I can address?
Absolutely. So I'm glad you have this question up. We did get a question that came in a little earlier, just talking about food, actually, if there's something that a person could feed their gut to help with hot flashes. So I'd be curious as to what your knowledge and expertise is around that.
So feed your gut. So I'm assuming people are talking about the imbalance of flora that we get when we're on chemotherapy. So there's a bunch of different approaches to that. So the best way to get your bowel flora back is to be sure you've got lots of fiber in your diet. And so that's where that anti-inflammatory diet can be beneficial. Fermented foods seem to have a really powerful role in helping our own body flora rebuild. So fermented foods being like pickled things that are freshly pickled. So you're getting them from the deli, not from a shelf. They still have the cloudy stuff in them. A lot of people pickling stuff on your own. Yogurts that say they have active cultures on them. Probiotic drinks and the kombuchas and all those things that are out there now probiotics might be beneficial, and there's a range of good probiotics. Femdophilus and the lactobacilli in it is decent for your gut, but sometimes there's other ones you need. And so sitting with someone and talking to them about it is kind of where I'd go from that.
Perfect. Thank you.
Looking at the other questions. So belladonna back in the 90s was one that we really used, but we have so many better things now that are less toxic and have less side effects, right? The belladonna dries the mouth, changes a lot of our acetylcholine and the endpoint of it's kind of like clonidine. It's the end of the stress nervous system, not the beginning that it's impacting. So I think there's better stuff out there. The health curious if those risks are just while on hormone therapy. No. Early menopause. So there's symptoms just of menopause, right? We know, like, even after natural menopause, that's when cardiac risks, bone loss, and all those things become a factor. People who go through early menopause just have higher risks because we're going to have a longer period of life coming with that. And so all of those things about thinking about physical activity and prevention, like, those are not just about being on anti-estrogen therapy. That's just about natural menopause. And the fact is, and I think, like, why, like, the fact that we're finally talking about menopause, like, most of us are going to live, 35, 40, 50 years, right? After we've gone through menopause. And so knowing, like, how we can keep our bodies in best health. So alcohol and this triangle, this is why I add this. I messed my slides. Women, alcohol is really closely related to breast cancer risk, probably through how it impacts our liver. And so the 1 to 2 a day is only for men. 1 to 2 a week. That's what I recommend. Okay, holidays are coming and maybe you go 4 days in a row. That's not a big deal. Just don't do that every day, right? So what we do on special occasions, I worry a whole lot less than what we do every day. But 1 to 2 alcoholic beverages a day is not safe for women, especially women with breast cancer. That's why I put the little, I should just draw I'm not great at making these kinds of things. I should just draw my own. But that 1 to 2 glasses, that's why I have the little box over here. 1 to 2
I love that. And I will say we are doing a speaker series again in December around alcohol and breast cancer. So we're bringing back a speaker just to touch on that because it comes up so often. Dr. Singh, I did have a question that came into me directly. And this person said they have so many bladder infections since on Arimidex. She's taking D-mannose plus cranberry, anything else because she still gets them.
One of the things to read about is uva ursi. It's another really interesting bladder soothing agent. And then, I assume somewhere in the path of this, you've seen your gynecologist and they've made, that they've looked at the vulva, they've looked at the urethral opening to see if there's things you could do locally that would help. But in terms of, like, pure supplements and herbs, D-mannose is a really good one. And the things that contain the cranberry, also Vitanica is a good company for that. But then look up uva ursi and talk to your doc about it.
Wonderful. Thank you. And we did have another question just about tamoxifen. I'm wondering how long it takes for tamoxifen to bring on menopause in most people. What's your experience?
It doesn't cause menopause in everybody, right? So it depends on when you start it, right? So there are women premenopausal who are on tamoxifen and will come and never go through menopause on it. So it is different in the side effects it causes. Oh, this is, like, such a great question, and I could literally talk about it for an hour. The aromatase-induced joint pains and myalgias. So it seems like the aromatase, the joint stuff, is a totally different pathway, that it might be like more of a fibromyalgia kind of related pain, not how we used to think about it, which was more of like an arthritis related pain. So they're like thinking about the things that can potentially help with that. Thinking about something like CoQ10, thinking about all of the, there's a bunch of adaptogens that are in that class. It is 7. And so maybe that'll be something that we think about doing, like where we just have a smaller group conversation about aromatase inhibitor side effects.
Absolutely. Yeah.
So in terms of herbs and supplements and cancer recurrence, the ones that have the most interesting data are the adaptogens. Turmeric has some interesting data because it like is such a potent anti-inflammatory. Although the data is a lot stronger for the GI tract related cancers like colon cancer and decreasing recurrence and preventing polyps. But there's ways to get it more systemic. Astragalus, soy, a lot of these. And if we think about the complexities around cancer recurrence and why even like, physical activity of 30 to 60 minutes a day, decreasing cancer recurrence and why that would be, and thinking about like how it might be mediating our stress nervous system, how it might be decreasing inflammation. Yeah, a lot of them. And again, like that's a whole separate talk, right? Approaches to cancer prevention and decreasing cancer recurrence and using herb supplements and lifestyle approaches to it. But I have taken 61 minutes of your guys' time, and I just want to thank you all for participating in this group and for coming, and to thank, Unite for Her for being such an amazing resource for women and for the community. You guys do great work, and it's just my joy and my pleasure to work with you guys.
Well, thank you, Dr. Singh. Yeah, it was really good. So informative. I know, I saw in the chat if people wanted to share their experiences, and, I just want to say, be gentle with yourself. I was there through so much of this. I remember the vaginal slits on my vaginal wall during chemotherapy. I remember going into forced menopause, when I was first on chemotherapy. Good Clean Love was like such a savior for me. Acupuncture, such a savior for me. There's not, I don't know if you agree on this, Dr. Singh, but for me, there was not one magic bullet. There was a variety of things, right, that I had to lean into that I knew would work for me. And there's this trial, and you take the words that Dr. Singh gave us today and you think, what can work for me? And where can I start? One step at a time, where can I start? And then it does get better, and then that's what I'm sitting here, right, 19 years later saying, it got better, right? And I didn't lose my sexuality, which I thought I was going to lose. And, that was when I was 39, right? And it got better. But I also had to take an active, did the acupuncture, looked for moisturizers. I never even knew to moisturize. I had no idea to moisturize the vaginal wall. I just thought it was all lubrication, right? Not like how we moisturize our bodies. So I thank you. It's really an important topic, and we can keep at it, right, Erin? Sometimes we do a part 2, right?
Absolutely. Absolutely. Well, Dr. Singh, I think we are going to have you back in the spring next year, I think, for a Q&A. So she will not be gone long because we know how important this topic is. But we do thank you so much for your time and sharing all of those incredible resources. We will absolutely make them available to our members and for those that want to hop onto our Her Library. So thank you so much.
Yeah. Thank you, Dr. Singh.
Yeah,
really great. I know. Thank you all for joining us tonight. It's so important. I'm glad that everybody was vulnerable and put your questions out there. If you still have questions, put them in, the chat. Send us an email at info. A lot of you know Erin, right? Or myself. You have our emails. We are here. And so just send us the questions because we can call up Dr. Singh or Dr. Burgoon or one of our advisors, right? And again, the questions on alcohol and breast cancer, Erin, right? Like,
yep.
Erin has done now 3, right? We're on number 3 coming up.
We have number 2 coming.
And then we did an Ask the Experts, right? Didn't we do an Ask the Experts and 2 speaker series? Did we ever do that? No. Maybe we thought about it.
I did. But
I
we're
get,
bringing it back around the
yes.
holidays for a reason. I love that question because it is, you know, it's a challenge that a lot of us have to sort of confront. And how do you work through that? It's a dance. So
Yeah,
we will have
sure.
that available because it was wildly attended and interested.
Yeah. And Erin has a lot of mocktails. We've been doing so much with zero
Oh,
proof and mocktails
yeah,
and recipes. And, you know, I'm getting ready to watch a Phillies game and I have my grapefruit tonic in my wine glass. So I'm like, all right, I
I
can do
love it.
that. I can do that. Right. So yeah,
Absolutely.
it's all
Good.
good. You know,
Yeah,
one step at a time. Yeah. One step at a time.
definitely. So
All right,
definitely
Erin, you
stay
want to take
tuned
us
for
off?
part 2. Yeah,
Yep.
stay tuned for
Yeah.
part 2 with Dr. Singh in the spring. Hopefully you'll join us for Ask the Experts next Thursday, 1 p.m. Eastern time, streaming live on Facebook, Triage Cancer, Insurance, Cancer, Legal with
Yeah.
Joanna Morales, the best of the bunch. So she'll be with us next week to wrap up October, I should say. And then again, I want to give one final thanks to West Pharmaceutical as our presenting sponsor and Daiichi Sankyo, Lilly, Merck, and GSK for being our supporting sponsors and helping us continue to bring wonderful events like this evening.
Yeah.
So thank you so much, Dr. Singh. Thank you all of you for joining us this evening.